Are we on? Okay, so Amanda, we're real excited for you. Thank you for, I love these tattoos. I didn't even see your tattoos. It's pretty hot stuff there. Okay, so anyway, you obviously have a lot of nasal breathing problems. You're a nurse, right?
Yes.
At Sears?
Yep.
Okay, cool. And you have a lot of nasal breathing problems. So we're obviously going to fix that. And then we're going to do a little bit on the outside of your nose. Can you see your nose without your glasses on?
Yeah. Not that great, but I can still kind of see it.
Oh, okay, cool. So your nose is crooked, so we want to get that part straight. Now, if we straighten out that much, it's still kind of crooked on the axis here, and the nasal bones are definitely asymmetric here. So I could fracture your bones straight to get that little extra bit of straightness, and we probably need to do that, as well as your tip is quite funky there. So we're going to try and even out these cartilages. Down here, your tip's kind of uneven. So there's a lot of stuff to change there. And we're going to get nice improvement there. I'm hoping we can get it all perfect for you the first time, but you have a lot of little cartilages there. So I will worry that you may be left with some little bump there. It's going to be much better, smoother, more even, but you know, sometimes we might have to do some little touch-up on something there. But I'm thinking we probably need to fracture your nose if we're going to get the bridge straight for you.
And what about this bump? You said you thought you could file that down too.
Right, right. If we're going to fracture it straight, we're going to kind of just cut out and file it. Yeah. You almost have, your bridge is so flat up here that it almost looks like you either hit on that side of the nose or hit something like that when you were small. You fell and you bumped your nose and the bones splayed out and got pushed over because your nose makes this nice S thing there, so it's all a little wacky there.
Yep.
So we've a lot of fun stuff to do in there when we get in there and mess around there. Okay, you excited?
Yeah.
Oh, okay. That'll be fun. And your breathing problem is quite severe.
Really
Are you using sprays or medicines for your breathing right now? What do you use?
Well, I was using just like Flonase spray, but they gave me 2 different ones this time. I don't know what they were.
Okay.
Steroid sprays.
Okay. You brought your Afrin and your Sudafed?
Yes, I did.
Okay.
My mom has it.
All right. Keep that. Okay, we're here with Amanda, and so what we're going to do, first we're going to fix her breathing, because her breathing is awful. And you can hear how badly she breathes all the time, and just talking to you, and and after the surgery, you're going to watch how her voice is going to change, so she can then try out for Idol if she wants. And then we're going to fix this broken nose, the way it's twisted, and we're going to reshape her tip and give her a really cute nose there. So I'm really excited. She's a nurse over at the hospital, so we want to do an especially great job for her so that she'll tell all of her friends what power surgery we do here at Buying Beauty TV. So I just finished with the inside of Amanda's nose, and you can see how great we've done. Again, blood barely reaches the suction machine. We don't need any cuts on the outside, and we won't need any packing afterwards. And it's all nice and clean and dry, and we're ready to do her tip. And I'm excited because we're going to get a fabulous result for her. So Amanda has kind of a funky tip there, and I know both sides are not going to be the same when I take down these cartilages. So I know the shape of one tip is going to be different than the shape of the other because they look so different. But we're going to get them all straightened out for her, and again, clean and dry. And I can do everything I can without cuts on the outside, all through the inside. And here you can see a nice, clean, glistening cartilage for us that we're going to just trim around and reshape for her. It's got all these odd attachments which are partly what's curling it up in that funny fashion that we're going to release there. And that's going to come out really great for her. Go! So thank you. So I've trimmed off both these cartilages, and I don't know if you can see in here, if you zoom in there, you can see how they're really clean and dry, and I've got them exposed nicely here, and I can do whatever I want. I don't need to make cuts to put in grafts or sew things together or do whatever I need to do here. And again, no bleeding, and everything's just gone perfectly. Thank you. Thank you. Okay. So I'm really delighted. Everything happened as exactly I hoped and expected for Amanda's tip so far here. And we've straightened everything out now, and she's got a really cute tip, and we've created a tip point for her while leaving rim support for her, because I didn't want her her nostrils to get too pinched in or anything. So we've left good rim support for her. She's got thin skin, and so you got to be really careful, because in someone with thin skin, every little thing you do shows. Every little bit of a cartilage irregularity and whatever. And sometimes little irregularities are okay because they just keep the nose looking natural. They don't look quite so surgical. But in any case, her nose just looks perfect for her face, and I'm really happy so far. Okay. So I'm really delighted. Everything happened as exactly I hoped and expected for Amanda's tip so far here. And we've straightened everything out now, and she's got a really cute tip, and we created a tip point for her while leaving rim support for her, because I didn't want her nostrils to get too pinched in or anything. So we've left good rim support for her. She's got thin skin, and so you got to be really careful, because in someone with thin skin, every little thing you do shows. Every little bit of a cartilage irregularity and whatever. And sometimes little irregularities are okay because they just keep the nose looking natural. They don't look quite so surgical. But in any case, her nose just looks perfect for her face, and I'm really happy so far.